Our nutrition project scenario consists of a young French-Canadian couple with 3 children. The father is a healthy 19-year-old who works as a gas station attendant part-time in the evenings. He shares meal prep and childcare with the mother due to their work schedules. The mother is a healthy 18-year-old that works part-time day shift as a waitress at a local French restaurant. She is 5 foot 2 inches tall, weighs 160 pounds, and is moderately overweight. Both parents frequently eat takeout from the restaurant where she works. Their 2-year-old daughter is healthy with all immunizations current, however, is slightly overweight for her age. Their 9-month-old twin daughters are still bottle feeding with commercial infant formula. Both of the adults are slightly overweight with a BMI of 29. With the family being French-Canadian, we have found that their culture is based on foods that are high in saturated fats, high in sugars, and high in carbs. They also tend to lead a sedentary lifestyle as well as being social eaters. Some of their food choices are ragout de boulettes, cretonne, and butter tarts. Based on the food pyramid, we were able to identify the necessary caloric intake for each adult, plus the one minor child since the twins are still bottle fed. The father's required caloric intake would be 2,200 calories. The mother's required caloric intake would be 1,800 calories. And the minor's child, who is 2 years old, required caloric intake would be 1,200 calories. We decided to analyze and discuss the mother's daily nutrient requirements for a 24-hour period as such. Based on the assessment findings of the 18-year-old mother of 3 that is 5'2" and weighs 160 pounds, with a BMI of 29 that leads a sedentary lifestyle, the daily nutrient requirement as follows. Iron would be 15 milligrams, protein 58 grams, calcium 1,300 milligrams, sodium 2,300 milligrams, fat 70 grams, saturated fats 13 grams, unsaturated fats 40 grams, and fiber 26 grams. On a daily average, the mother should consume 1.5 cups of whole fruits, 2.5 cups of vegetables, 6 ounces of whole grains, 5 ounces of protein, and 3 cups of low-fat dairy.
With the assessment findings and taking family dynamics into consideration, led to the nursing diagnosis of imbalanced nutrition, more than body requirements related to excessive intake in relation to metabolic needs, and high-calorie foods as evidenced by sedentary lifestyle, weight 10% over ideal for height and frame with a BMI of 29. Expected outcomes for the family include verbalized factors contributing to their weight gain, engage of a minimum of 20 to 30 minutes of activity 3 times a week, lose 1 to 2 pounds a week while eating well-balanced meals, maintaining simple lifestyle changes such as using the stairs more or consider walking to work since they live a half-mile away. Understanding the expected outcomes led to the independent nursing interventions of 1. Assess the family's knowledge of nutritious diet, which is useful for developing an individualized teaching plan. 2. Define the family's ideal healthy body weight, considering physiological and cultural factors. 3. Validate the family's feelings regarding current lifestyle on the ability to prepare nutritious food. 4. Nurse will provide family with the necessary tools to assist in developing an adequate food menu, including proper nutrient intake. 5. Nurse will teach the importance of exercise. Many patients can benefit from establishing walking as a cornerstone of their physical activity. 3.5 miles per hour for 30 minutes can burn an average up to 140 calories. 6. By teaching family behavior modification techniques, such as limiting food intake to one side in the home, such as sitting down at the kitchen table to eat, is also important to measure food portions. Estimating amounts can be extremely inaccurate. As advocates for the family, we will provide an understanding of caloric balance. Caloric balance is like a scale. To remain in balance or maintain your body weight, the calories consumed must be balanced to the calories used, or burned by daily activities. By tipping the balance scale in the direction of losing weight, a caloric reduction of 500 to 1,000 per day is needed to lose 1 to 2 pounds per week.
In preparing the menu for the family, we managed to keep a few staple foods from their culture, as well as being able to incorporate some healthier choices to assist with the overall goal of leading a healthier lifestyle. They can still enjoy their ragout de boulettes and butter tarts, but in moderation. We have educated the couple to discontinue eating takeout food from the restaurant that the mother works in to be able to eat items that are better for them, such as wheat wraps and salads, and also to be able to save money. They have a weekly budget of $100 for food, and by making the change of eating out several times a week, utilizing coupons, and shopping at Walmart, we were able to stay within that budget. Upon a planned revisit within a month, we expect to find that the family has adapted to their healthier lifestyle choice, reduced their BMI, and has kept their reduced caloric intake in relation to their required metabolic needs, with the desired outcome of losing 1 to 2 pounds a week until they have met their desired weight.